Since society in America was all for changing their society for the better, they had to come up with ways to contain and reform the individuals who broke the laws and caused havoc. Enter the prison reforms. Pennsylvania was the first to take action and begin their penitentiaries, in which prisoners were placed in solitary confinement so they could think about and repent for their sins. The desired effect was that prisoners would reform and be allowed back into society. However, high suicide rates led to this penitentiary being shut down, but the effort not abandoned. New York was the next to try their hand at the penitentiary system. Their effort came out in the form of the Auburn system. While still having the strict rules staple of the penitentiary systems, they offered additional support to the prisoners with moral instruction and work programs to help better the prisoners and not to simply lock them up and forget about them. This proved much more effective than the previous system, and many of our current prisons follow this format.
Mental health reform was the result of poor conditions and abuse towards emotionally disturbed people and paupers, which was publicized by reformers such as Dorothea Dix. Dorothea would launch a cross-country crusade against their poor conditions. Reformers proposed new mental hospitals and better designed prisons. As a result of their effort, state legislature would set up new public institutions to help prisoners in the 1840s. In addition to mental health reforms, there were also reforms for blind and deaf people. Thomas Gallett would create the first deaf school, along with Lauren Cleck and Mason Cogswell. It was known as the Connecticut Asylum at Hartford for the education and instruction of deaf and dumb people, but is now known as the American School for the Deaf. Dr. Samuel Gridley Howe would start a school for the blind, the England Asylum for the Blind at Boston, which would eventually develop into Perkins Institution.
One individual who significantly improved the conditions for patients and spearheaded, however wrong his methods were, American psychiatry was Dr. Benjamin Rush. His goal was to organize all medical knowledge and form theories on cures around that. His goal led him to the mentally diseased, in which he began efforts of American psychiatry, which were later taken up by other individuals. And he eventually came across the poor conditions in the Pennsylvania hospital. These sites alone led him to campaigning for the patients in order to give them a separate mental ward in which the insane could be held.
Alcohol was another problem that was tackled during the 1820s. In the 1820s, each person would drink approximately 5 gallons of hard liquor, which was seen as the main cause of social problems. In 1826, Protestant ministers founded the American Temperance Society, where they attempted to persuade drinkers into a pledge to abstain from alcohol. The society was most successful in the North. In the 1840s, 6 recovering alcoholics formed Washington's Temperance Society, where they believed that alcoholism was a disease that required treatment. They taught sobriety, and members would seek out other alcoholics to share their experience with alcohol and how the society helped them. By the 1840s, temperance societies would have more than 1 million members combined. German and Irish immigrants would oppose the movement because they felt that it was an attack on their lifestyle. Factory owners and government officials, however, eventually realized the potential benefit that the temperance movement would have in productivity, saving money and reducing crime. In 1851, Maine would become the first state to ban intoxicating liquors such as alcohol instead of simply taxing it. By the start of the Civil War, 12 more states would follow to ban intoxicating liquors. However, by the time that the Civil War broke out, the issue of slavery would take the spotlight from the temperance movement. However, the issue would come back up in the 1870s and was eventually successful when the 18th Amendment was passed in 1919, which regulated intoxicating liquors except for medical and scientific uses.
Neil Dow, the president of the Maine Temperance Union, mayor of Portland, and stalwart of the American Prohibition and Maine laws. Rightfully nicknamed the father of Prohibition, he was the strongest political advocate of the Maine laws and the one who got the law passed in the first place. He enforced his law with fervor, constantly increasing the penalties and consequences for breaking the laws.
That's the sound of the police!
Benjamin Rush was the first Surgeon General for the Continental Army, and because he was trained in the medical field, he advocated for clean, sterile environments and stressed personal and military hygiene. He was also the founder of American Psychiatry, which is the study of mental disorders.